The WHO award to Asha is most welcome. It is recognition of the role that this huge workforce has played, and most difficult times, they have been a backbone of the Indian response at the community level. And in so many places, people have, Ashas have, whether it is contact tracing or supporting people or spreading health education or promoting testing, it's an invaluable role that they have played at great risk to themselves and their safety. We also remember the conditions of their work, not only because of the pandemic, but also because of their terms of employment have been very weak. So despite the fact that in many ways the state has not been seen as fair to them, they have still been able to make their contribution. So for all these reasons, I think the WHO recognition of the role that India's 1 million plus Ashas have played is really very welcome. So I think that the Asha's workers' struggle is a struggle for justice, is a struggle for recognition of the immense work and contribution they are making. And it needs to receive wide support, it needs to receive wide support, and hopefully they will win their demands. One important aspect that people need to understand is the government will hesitate on its commitment to the Ashas as long as even more basic principles they do not adopt. One principle is that the workforce, that the health workforce, that the public health workforce we need is a much larger workforce, and this workforce should not be contractual, but should provide jobs with a good amount of social security, not less than what the ESIC provides today. And therefore, unless you respect the rights of the health workers, you cannot actually deliver on the right to health. That is the main message on this. And at some point, I think this is the big message. But there is another message. As policy, in terms of the efficiency of the state, in terms of its availability of resources, in terms of it being able to justify itself within a hostile ideological commitment, the rights of the health workers will be won only when the government makes a commitment to universal health care. Only that can justify a workforce on these regular terms, because if you have agreed to provide universal health care, then this workforce requires permanent terms of employment. But if what you're doing is only ad hoc basis till you outsource the public services, then of course the pressure to keep them temporary and ad hoc continue. So the rights of the health workers are inextricably linked with the right of the community to health and healthcare. So one cannot be one without the other. And these two should merge. And the moment the commitment of the right to healthcare is made, of universal healthcare is made, the Asha will be seen as a necessity. In the last 2 or 3 decades of the previous century, from 1980 to 2000, number of small experiments had shown that community health workers is a good concept, it works. There was also the World Health Organization's Health for All call, which showed the importance of community health workers. However, because of structural adjustment policies, the thrust of government was to be on selective healthcare and deny any expansion of a public workforce, of government-paid, salaried workforce. In the 90s, the thrust of government policy under the World Bank, IMF dictates on structural adjustment was to keep public services to a limited selective package and also to limit all further employment in government, even in the government health workforce. So from 1993 to almost 2004-5, not a single nurse or doctor was recruited even to replace those who were retiring or dying or leaving the job, even in the, and especially in the poor performing states of the north. So in the face of such an attitude, in the face of such a policy, the NHM, which came through with a lot of civil society support and political support when UPA-1 was formed with both the support of left parties and a broad spectrum and a commitment for pro-people policies, they had to show something in terms of reaching healthcare to the poor. Already in year 2000, the people's movements, science movements had led and created the People's Health Movement in partnership with earlier existing health NGOs. But the heart of it had been the people's movements and science movements, and within that, the Bharat Gyan Vigyan Samiti. So the National Health Assembly rested a lot on the mobilization that these forces did. Subsequently, from 2002 to 2005, in Chhattisgarh, I had a lot of part to play, but so had a number of civil society organizations. And we must record the fact that the Bharat Gyan Vigyan Samiti ran the pilot of the mitanin program in 3 districts, including Jilla Saksharata Samiti, Durg, Marwahi, Podi Upoda in mitanin, and then Raigar also. So the organizations which had worked with total literacy campaigns were roped in to develop the pilots for the mitanin program. They ran up to 12 blocks, and then the program could be scaled up into what is known as the successful mitanin program. Now, mitanin is not a new concept in community health workers, but this is the first time that the government was able to be successful in it and that it could go to scale. When we started mitanin and when we later started Asha, everybody kept telling us how the 1978 to 84 period, the village health guides had been a failure, and how later the Jan Swasth Rakshak of Madhya Pradesh had been a failure. And they kept asking us, have you not read the history? Will it not fail again? And we kept saying, we have read the history, and therefore it will not fail again. And the difference that we had was a very strong collaborative state civil society organization, the State Health Resource Center in Chhattisgarh and the NHSRC, which I was supported by the Asha mentoring group, a formation of civil society organizations that led this program. In fact, the program was written by a task force set up after government intervened to overcome the earlier design under RCH2, which was a much development partner, a very limited understanding of the Ashas. That role was transformed by a task force which had active civil society participation from a number of NGOs and included us. And this set out the original guidelines. And these guidelines were rolled out with the help of different civil society organizations, many of them associated with the science movements and health movements. So it was a part of actually the demand that we had raised that there needs to be a health worker in every village.